Hello, my friends. It's me, Patriot Prepper 1776. I went through my surgery yesterday, and I'll put some pictures up here of what went on. Just got two pictures. I didn't take pictures all the way through and everything. This is going to be a super short video. I don't have the results yet. I'll have them. I have to go back and see the doctor Tuesday of next week, which is a week from today. And I'll go back and see him, and then he'll probably let me know then what the results are. Sorry, battling flu or some kind of crud here. I think I got it what I call the germ factory, the hospital. Every time I go to a hospital, I seem to get sick. Every muscle in my body hurts. Every joint in my body hurts. My whole body hurts except for where I was operated on. I know. It's ironic. But anyway, I went into surgery and they told me that recovery was going to be about 2 to 3 hours at least. Well, they took me out, done the surgery. Last thing I remember, they put a mask over my face and I'm laying there looking up at the lights. And I remember taking about 5 breaths. And then next thing I know, I'm waking up in a recovery room. My eyes were going all over the place. I'm trying to see the clock on the wall. Couldn't see the clock because it's too far away. I'm nearsighted. Finally got my eyes to work and cooperate and focus. And I was only in the surgery and recovery and everything about an hour and 15 minutes. They told me the surgery would take about an hour and I'd have about 3 hours in recovery. I was waking up quick. And then they came along and letting me go. I had to get dressed. Dressed myself. And then he wanted me to ride in a wheelchair to go out to the car. And I was like, ain't no way I'm sitting in no damn wheelchair. No way, ain't no how. I'm going to walk out of here. I can stand up, get myself dressed, I can walk out. But they wanted me to ride in a wheelchair, and I told them no, and they told me it's law. I said, I don't care about the law. I'm walking. If I'm able enough to stand up and get dressed and bend over and put my underwear on, my pants on, and my shoes and socks and everything, I'm able to walk. I'm not an invalid. I don't need to sit in your wheelchair. So me and one of the guys walked out. Went with me, make sure I didn't fall or anything, which I wasn't going to. But there's a story behind why I didn't want to sit in their wheelchair. When I was 26 years old, I went for a job interview to work offshore. They done x-rays on my back and informed me they couldn't hire me because I had a bad back. So I went to 2 more doctors to see about what was going on, and they all told me at 26 years old, by the time I was 30, I'd be in a wheelchair. I'm now 44, and I'm still not in a wheelchair. Never have been in one, never will be in one. And that's why I wouldn't sit in their wheelchair. I know there's going to be somebody holler, well, it's their policy, they have to do it, I understand that. And that's my policy. I don't use something unless I need it. I didn't need that. Anyways, as I promised, I'll put these pictures up. And I'll tell you what's going on in the pictures. In this first picture, you're just going to see the pad over where they cut me open. You can't see nothing. They won't let me take the pad off until next Tuesday. And on my boobs, or breasts, or man boobs, or moobs, or whatever you want to call the damn things, they wrote yes and no. Before the surgery, they took me in and they done another mammogram on me, second one, They did an ultrasound on me. They did an ultrasound first, and then they found where the mass was. It was right where I said it was, 9 o'clock position. Then they proceeded to give me a shot in the right breast to numb it, which it didn't numb it. I didn't say anything. I'm a tough old goat. Or a tough SOB, as I told them. And they explained to me they was going to stick a hollow needle in, and then they was going to thread a wire down through that with a barb on the end into the mass for the doctor, so he knew where it was located at exactly and everything. They done that, and then they put a paper cup over my nipple and taped it down, had me put a gown on, and wrapped a gown around me, paraded me through the hospital. Then they took me over to do the mammogram, and done a mammogram on me. Taped the cup back on, paraded me back through the hospital again, over to pre-op. And I laid there for about an hour and a half, 2 hours. Took me in, done the surgery, wheeled me back out, and I woke up, walked out. But this next picture you'll see will be of me with the be my right side of my chest where my tattoo is. My one and only tattoo. And they wrote the word no. On the other side they wrote yes. So the doctor knew which boob he was operating on, like the wire sticking out. Wasn't a big enough sign, I guess. Anyway, that's what's going on with me. I'll let you know when I find out something. You have a good one.